Opening in Vaughan will now be focused on the fight against COVID-19.
The ICUs in Toronto should be at capacity by the end of the month.
The province hoping the new hospital will help ease pressures on nearby ICUs stretched to the limit by the pandemic. Plus,
absolutely every single person should be allowed to have a minimum of 10 days paid sick leave.
Calls are intensifying for Ontario to offer paid sick days. The mayor says it's an urgent issue, but the premier is not budging. What will it take to make it happen? And
what I did is I just yelled, stop, 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 stop.
The demolition of heritage buildings in the West Don lands goes ahead despite pleas from the community and ongoing efforts to save them. Good evening, I'm Kelda Yoon. Hospitals across the GTA are feeling a lot of strain right now as ICU beds continue filling up with COVID-19 patients. The pressure is so great that there's been a change of plan for a new hospital in Vaughan. The province announcing today the new facility will be used to take in patients from nearby hospitals that are hitting capacity. Queen's Park reporter Mike Crawley has the details.
See how large the
Premier Doug Ford gets a preview of Ontario's newest hospital. When it opens its doors in early February, the Cortellucci Vaughan Hospital will take both COVID and non-COVID patients off the hands of other GTA hospitals hardest hit by the pandemic's second wave.
This incredible state-of-the-art hospital, it's like reinforcements coming over the hill.
As of midnight last night, Ontario's ICUs had 416 patients critically ill with COVID-19. Hospitals expect that number to hit 500 within a week, and the projection is for 600 early next month.
We don't have months to wait for these beds to come online because this is a serious capacity challenge that our hospitals in Ontario are experiencing right now.
Some hospital intensive care units are already full and are even transferring patients to other cities.
The ICUs in Toronto should be at capacity by the end of the month. So any type of relief valve that doesn't involve sending patients to Kingston or St. Catharines would be helpful.
The Vaughan Hospital will be part of 500 additional beds the government promised today. It's a mix of ICU and what are called high-intensity medical beds, a step down from intensive care. The government isn't saying how many of each, nor is it clear where the staff will come from.
That's really the most important thing, to be able to actually care for patients in those new beds.
And what if there are simply too many patients for the ICUs to handle? This document shows what provincial experts are proposing. This would make patients most likely to die in the next year lower priority for intensive care beds.
You don't want to think about it in the heat of it. You want to lay these things out ahead of time. So I think they've done that with the hope saying, we hope to never have to use this.
A government spokesperson says that triage protocol document is still a proposal and has not yet been approved by the Ministry of Health. Mike Crawley, CBC News, Toronto.
The Toronto Board of Health today called on the Ontario government to provide 10 days of paid sick leave. That's among several other immediate measures it says will help curb the spread of COVID-19. Now, the federal government has a sick leave program, but many are criticizing it for not protecting enough people who need it. As Ali Chiasson reports, calls are intensifying for the province to step up.
When it comes to the ever-present issue of paid sick leave and the continuous criticism the federal plan gets from workers, policy advisors, and doctors alike, the Premier says,
Does it need to be changed? Sure, it needs to be changed.
But for now, he's not going to.
There's no reason for the province to jump in there when less than 27% of the overall program hasn't been taken up.
It's a fantastic program, don't get me wrong.
Sabina Vohra-Miller is the co-founder of the South Asian Health Network and advocates for the community that's disproportionately affected by the pandemic because of precarious work.
So then where does CRSB fall short?
It's not meant to be used in just for a couple of hours or for a couple of days. You have to be missing out on at least 50% of your work week. It's not as simple as being able to take a few hours off to go get tested or take a day off if you have mild symptoms. And what you get is $450. So it's actually $500, but $50 gets held back. And then you wait a couple of weeks for it to come in. And so this is really hard for someone who is trying to make ends meet, someone who has, is working paycheck to paycheck to pay rent, to pay food.
Mayor John Tory, fresh off a meeting with other big city mayors, said the province should make it compulsory that employers approve the leave and the feds would pay back the employer.
That way you don't get into the whole business of filling out paperwork and so on. You just say to people, yes, you have the time that you need to isolate during the pandemic. Yes, you will get that benefit from your employers, and the federal government will then reimburse those employers.
We received a statement from the Office of the Minister of Employment saying, quote, the federal government is funding this temporary benefit while provinces and territories are to establish job-protected sick leave through regulation or legislation if it is not already available. Mandatory paid sick leave doesn't exist in Ontario, not since the Premier cancelled the program in 2018. The statement goes on, quote, we will continue to work with our partners at all levels of government to ensure workers have access to this support when they need it most. If there's room for collaboration, there could be room for improvement.
We're having conversations as we speak.
Ali Chiasson, CBC News, Toronto.
The delay of the Pfizer vaccine is having a big effect on the vaccine rollout here in Toronto. The city's first vaccination clinic opened today and was expected to stay open for weeks. But as Angelina King reports, the delay is now forcing it to suspend operations after just 5 days.
They waited 2 meters apart for a dose of protection. Shelter and harm reduction workers excited going in, relieved coming out.
I think it's a great first step in the right direction. I feel great.
I work in shelters and also have a 72-year-old mother that lives with me who's got some immune compromised health issues, and it's been a long time coming.
But for others, that wait continues. The clinic was supposed to operate for at least 6 weeks, vaccinating more than 5,000 people with both doses. But now it'll be suspending operations on Friday after vaccinating just 1,200.
The fact that we learned today that we are going to have to pause only after the first week is very disappointing to all of us.
Peg says the Pfizer reduction is to blame. Late last week, the company announced it's temporarily delaying shipments as it upgrades its facility. Toronto's top doctor says that means Ontario will receive a 20 to 80% decrease in vaccine doses over the next month.
Stay patient and stay optimistic. There is good reason for both.
She says before the delay, workers were able to administer the first dose in all 87 long-term care homes in Toronto. Now the priority is completing second doses rather than immunizing new people. This clinic is supposed to serve as a blueprint for how other vaccination sites will run across Ontario, and a playbook was to be written on its operations, but now that learning goes from 6 weeks down to 1, so a decision will have to be made.
Whether or not we feel that we have sufficient quality assurance in place to produce a playbook. So somewhat of a work in progress.
Yesterday, the province's vaccine rollout lead said he'd like to have all of Ontario vaccinated by early August.
We're planning for large numbers of vaccines to be here, and when they come, we're going to be able to use them all. You know, we're planning on a capacity of more than 150,000 vaccinations per day in Ontario.
Amid all this, the city says it's still planning to be able to open up multiple vaccination sites before at least April 1st. Dr. Davila says Pfizer's production should be caught up in February and March, and meanwhile, Health Canada is looking at approving 2 more vaccines. Angelina King, CBC News, Toronto.
A long-term care home in Barrie is in crisis mode tonight as it struggles with one of the biggest COVID-19 outbreaks in the province. As Chris Glover reports, what's particularly concerning is how quickly the virus is spreading inside the home.
For months, Roberta Place long-term care home in Barrie was spared by COVID, but now it's in crisis.
I have a ton of people praying for me and my mom in the home.
Debbie Rhinus' 90-year-old mom, Orma, is living there with Alzheimer's and is showing COVID symptoms while awaiting test results.
And then we got locked out on the 8th when this first hit, and we had 1 case, right? And then it's just gone exponentially from there.
In the 10-day outbreak, 63 residents there and 53 staff have tested positive for COVID. 9 residents have died.
The protocols are as tight today, if not tighter than they have been. You know, I know there's speculation that this virus might be behaving like the mutated virus with the virulence that we're seeing here.
The local public health unit says further testing is underway to determine whether the new quick-spreading UK variant is in the home. The province says so far 15 cases of it have been identified in Ontario, some without travel.
This is concerning to all of us, especially as the data indicates that this variant may be spread about 56% more easily than other variants.
I wouldn't jump to variants as being the cause of it.
Infectious disease specialist Dr. Isaac Bogosh says there are more pressing questions to answer.
Do they have the resources necessary to rapidly identify an outbreak and to manage an outbreak?
The local public health unit says as of today, all residents and staff at Roberta Place have been tested for COVID. It's one of 8 nursing homes in Ontario where the Red Cross is helping, and a local hospital is now running things. Plus, this past weekend, Dr. Wright, some staff, and 71 residents there were vaccinated.
The vaccines are too late for this home. They're not going to do them any good. Let's face it.
Rhinus worries buoyed by her faith and signs her mom is improving.
I also understand that she's taking her oxygen off and trying to walk, so she's not dying just yet.
She's a fighter.
She's a fighter. Yeah, she's a fighter.
Chris Glover, CBC News, Toronto.
The provincial government started to tear down heritage buildings in the West Don Lands today, despite calls from the community to preserve the structures.
I think what it means is that the people who live in this city appear not to have a say in what happens in the place that they live.
The Dominion Wheel and Foundries Company site has heritage designation, but it's provincially owned, and they have a ministerial zoning order that allows them to forego any public consultations. There was hope for the site to become a community hub with affordable housing. The province says it will build 1,000 affordable housing units, but a local city councillor questions the timing of the demolition and wants the province to respect the building's heritage designation.
Why under a global pandemic are they rushing to demolish these heritage assets that have been registered on the city's heritage register since 2014? This is absolutely outrageous. I think it's borderline criminal.
Residents and local politicians are calling on the provincial government to immediately halt demolition and work with the community about the future of the site. After the break, an enforcement blitz at big box stores over the weekend. Just how many are complying with COVID-19 restrictions? Our Greg Ross looks at that coming up. Plus,
if you're looking for some sunshine in the forecast, I'm meteorologist Colette Kennedy. I'll tell you where your best bet is. Winds picking up tomorrow. All kinds of information coming up with your forecast after the break.
Many people were out shopping this weekend at big box stores, which are allowed to stay open. And it wasn't just shoppers scouring the aisles. Dozens of inspectors were also out making sure stores were complying with COVID-19 rules. And as Greg Ross found out, many were not.
We sent just over 50 inspectors out on Saturday and Sunday to 240 big box stores in the GTHA.
A weekend blitz to make sure big box stores are complying with COVID-19 regulations. Many are not.
We found a 72% compliance. Not good enough for me, quite frankly, at this stage in the pandemic. Businesses know what they need to be doing.
According to the Minister of Labor, there were a number of areas where big box stores received a failing grade when it comes to keeping customers and staff safe.
The three main infractions that we found included following masking protocols, the pre-screening of customers and workers coming in to the big box stores, and issues around physical distancing.
Some say these problems are being created by the province.
No other province in Canada is doing it this way.
Dan Kelly is the president of the Canadian Federation of Independent Business. He says that closing down small businesses has forced people to shop at big box stores, overwhelming them with larger crowds and longer lines. He says small businesses could alleviate some of the overcrowding while doing a better job of enforcing COVID-19 protocols.
You could limit the business to serve 1, 2, or 3 customers at a time, allowing the business owner to have no problem to ensure that there is strict COVID compliance.
Beach's East York City Councillor Brad Bradford says the province shouldn't allow big box stores to continue selling non-essential items.
We are seeing too many people engaging in browsing, picking up the non-essential items, and frankly, spending a lot more time in those big box stores than I think we want from a public health perspective.
At this point, there's no indication from the province that there's any consideration of changing course, but the Minister of Labor says he is prepared to ramp up inspections, and if non-compliance continues to be an issue, he isn't ruling out closing down some of these big box stores.
We've done 35,000 inspections. During COVID, we've shut down 55 workplaces and job sites during this pandemic, and I won't hesitate to shut down any others.
Greg Ross, CBC News, Toronto.
Here's a look at how COVID rule enforcement in Toronto went this weekend. From Friday to Sunday, the city and Toronto Public Health received 165 complaints related to non-essential businesses and issued 10 charges. Meanwhile, when it came to illegal gatherings, Toronto Police received 188 complaints and issued 41 charges. Cloudy with a few flurries overnight. Currently, it's -1 downtown. Colette Kennedy joins us now with a look at our forecast. And Colette, these temperatures can't really complain. It really has been a mild January so far.
Has it ever, Kelda? And I mean, the truth is in the actual numbers, and we can look at this in different ways, but we are in first place if the way we choose to look at it in terms of the warmth. This January of 2021, getting to the 18th with only 3 days where our daytime high didn't get up to 0, equal to, or above. Yeah, it does make this a very mild January when you're looking at it in those ways. We have to be thinking about climate change in here when we are seeing this kind of activity, and that's why we keep bringing that up. Now, I want to talk about something else. I want to bring up the winds kicking up from the west to southwest, becoming quite breezy, especially through the day tomorrow, and you're going to notice more of a wind chill tomorrow morning than we have right now. Sunny breaks. Yeah, we should get a little sunshine in there, but also flurries coming in there, so it's not a lot of sunshine, and we'll see those flurries sort of off and on. And in terms of those numbers, daytime highs, yeah, that's why today was another one of these days, just above freezing. Toronto up to 1 degree. You didn't quite get there for Peterborough and Barrie, below the freezing mark there. So with those winds coming across the lakes, as I say, kind of shifting direction a little bit, so it changes where we see some of the flurry activity. But we get into that into tomorrow morning, and some sun trying to peek through, mixing in with the clouds, and then the flurries sort of move around. We'll be seeing more of that activity into the afternoon and early evening hours as well. And then you could see more with that westerly flow, how they sort of change, those little streamers. It is lake effect that we'll be seeing, but it's just not as significant in terms of any accumulations down into the GTA, but we could get a few centimeters, of course, back closer to the shores of Lake Huron there. Looking ahead towards Wednesday, in fact, Tuesday night into Wednesday, we're going to have some colder air move in, so you're going to feel that. It'll be a significant change from where we've been when we have a daytime high of about -4 to -5 for midweek. Our wind gusts, I told you those kind of picking up through the overnight by points tomorrow. It's not necessarily reflected here. We may see some of those gusts exceeding 50 kilometers an hour. Your temperatures for southwestern Ontario, take a look at these numbers for your lows and then where we go for daytime highs, hardly a change. So nearly steady with the temperatures there, and also breezy conditions for southwestern Ontario. A range -7 for Markham to around 0 or at least close to for St. Catharines. You may dip a bit below at times. And then for tomorrow afternoon, again, you're noticing what happens with the temperature there as it actually goes down. There's that colder air that's coming in midweek. We go back up for Thursday and Friday, but a really important note is that next weekend, Kelda, and then the week after that, so really ending January, we're actually going to be closer to seasonal with our temperatures.
All right. Thanks so much, Colette.
The weather is brought to you by Trane, the most reliable heating and cooling brand. We test, so it runs. It's hard to stop a train.
Coming up, how art is helping researchers understand the pandemic's effect on children's mental health. We'll tell you more about the project that has gathered more than 100 drawings from kids and teens across the country after the break. Today is the third Monday in January, a day many refer to as Blue Monday, the most depressing day of the year. Now, there is no scientific proof to suggest Blue Monday is real. The day actually got its name back in 2004 from a British travel firm trying to boost sales. But while many experts call Blue Monday a myth, many still use the day to talk about mental health, especially during the pandemic. Well, you've no doubt heard the saying, a picture's worth 1,000 words. Well, researchers are using that belief to help better understand how children are being affected by the pandemic. Talia Ricci has the story.
Through art, kids and teens illustrate some of the things they're thinking and feeling right now. Researchers believe it can paint a picture of how the pandemic is impacting our youth.
We're doing a qualitative research study to be able to look at themes and patterns that emerge over time.
Through the project called Child Art, Dr. Nikki Martin has already gathered more than 100 drawings from across the country and from various age groups.
I thought it was really important during the pandemic that we hear and understand children's voices.
Do you miss your friend?
I miss my friend.
At daycare, it was, in the middle of everyone all the time and very cheerful. And now you can see that it's very difficult for him. I think it's more difficult to play with someone.
Many of the children's drawings show people alone, wearing masks and appearing sad. But Martin says there's also some hopeful imagery.
There's this lovely drawing of two hands together intertwined. And that to me feels like this, we're together and this real sense of hope, of connection.
Kids Help Phone knows how difficult this has been. Their call volumes have more than doubled from 2019 to 2020, and they expect those numbers will continue to rise.
We're seeing young people in really significant distress. Certainly, I would say one of the big challenges for all of us, but particularly young people, is dealing with disconnect, dealing with isolation, and potentially dealing with being disconnected from those that are their regular support network, whether that is their friends, that is their teachers, their coaches.
Playing on the playground and playing with my friends.
Yeah, and how do you feel when you don't get to see your friends?
Sad.
Martin plans to continue collecting art for the duration of the pandemic.
Once this is all done, we'll be able to go back and hopefully it will tell us something about, what children have experienced during the pandemic, what the impact is, and maybe we'll be able to foresee how we can help and support them in the future.
Talia Ricci, CBC News, Toronto.
And that's our show for you tonight. Thank you so much for watching. I will see you back here tomorrow night at 11. Have a great night, everyone.